Hello and welcome to Health Chat program. This is a program that looks at various health issues and other related issues concerning our health. As you may be aware, we are still looking at issues to do with maternal health. And this week is Safe Motherhood Week, and we are trying to look at different issues concerning our mothers. And on today's program, we are looking at pre-eclampsia, which is a condition which is more prevalent in our pregnant mothers. And so to help me look at this very important issue, I have with me guests from the University Teaching Hospital to come and just highlight us and the community on what this condition is all about. And so on my immediate right, I have Dr. Mkape, who is the OBS and GYN specialist, and he's also specialized in human anatomy. Welcome to today's program.
Thank you, Faith.
You're welcome to Zanes.
Thank you so much. Thank you.
All right, and thereafter I have Sarah Chola, who is acting nursing sister from the labor ward, and this is from the University Teaching Hospital. Welcome to today's program.
Thank you, Faith.
All right, and on my far right I have Sahan Lungu, who is Health Promotions Officer, also from the University Teaching Hospital. Welcome to today's program.
Thank you so much, Faith.
You're welcome to Zanis Studios.
Thank
Thank
so
you very
much.
much.
All right, we are looking at this condition, which is pre-eclampsia. What is that?
Okay, maybe I can take that one.
Oh, yes.
Yeah, so pre-eclampsia is basically a two-word in one, as you can see. So pre is coming from Latin. It's a prefix, which means before. And eclampsia comes from the Greek word. It's actually a Greek word, eclampsia itself.
Okay.
And it basically means sudden occurrence, meaning a flash of light can just come suddenly. Okay. Yeah, so it was used, it can come without any warnings, just like the way thunderstorms come during rain season and so on. So you will find that it can just occur anytime.
Okay.
So now, when we are talking of preeclampsia, we are basically meaning that it's a condition that occurs before eclampsia.
Okay.
Okay. Yeah, and preeclampsia simply means it's a pregnancy-specific condition. You have to know that it's very specific to pregnancy. It can just occur during pregnancy or soon after birth, up to 42 days, which is 6 weeks,
Okay.
basically. And it is a condition that is characterized by high blood pressure. Usually the blood pressure goes above 140 over 90, as well as passing of protein in urine, significant protein in urine. Yeah. So, and this condition occurs after 20 weeks of gestation, meaning pregnancy, after 20 weeks of pregnancy.
Okay.
Yeah. So that is basically eclampsia. Now, the passage of protein in urine simply means that at the level of the kidneys, you find that the filter there is damaged, basically. Yeah, so that filter, it separates small molecules from larger molecules. So larger molecules are not supposed to pass in urine through that filter. They're supposed to remain in blood. Mm-hmm. The moment we see protein in urine, it means that at the level of the kidneys, at the filter level, there is damage already.
Okay.
Okay, so it can actually, it's a progressive disease, meaning that it worsens with time. It's like you're climbing stairs. Today the condition is like this, tomorrow it's like that, and so on, until it can actually come as fits, which we call seizures.
Okay.
Yes, so a number of organs can be damaged. It's a variety of organs. The kidneys, I've mentioned them, but also it can damage the liver. Okay, one can get brain damage as well as lung damage or fluid accumulation in the lungs, okay. And then that will cause difficulties in breathing. Okay. Yes, and including blood itself. One can have problems with clotting of blood. Okay, so you can see that it's a condition that is very, very serious, very dangerous. It can actually lead to death of the mother and the baby. And if the mother and the baby haven't died, it can actually lead to disability. Okay, there are a number of disability and to the mother and the baby. So you will find that this condition globally, it affects, it causes about 300,000 maternal, meaning mothers dying.
Yes.
Okay, 300,000.
It's quite a huge number.
Exactly, that's globally. And about 500,000 babies die because of this condition.
Okay.
Yes, so out of this number, you find that majority of these cases are actually found in the sub-Saharan Africa, including Zambia, basically low and middle income countries, where this condition is usually undiagnosed and undertreated. So maybe those statistics somehow may actually be, you know, we can have more than that. Yes, exactly. So that is basically preeclampsia.
Okay.
The cause of preeclampsia, we don't really know the exact cause of preeclampsia.
Okay.
For over 2,000 years, we don't know the exact cause.
Okay.
But we have theories which try to explain the events that occur during preeclampsia.
Maybe just on that one, Doc. Let me just cut you because I know we have to do on that one,
okay,
so that at least people can get the gist of what this is.
All right. Maybe
just to highlight on the same preeclampsia. Is there a difference between preeclampsia as it is and just eclampsia?
Yes. There's a very much difference. Like I said, preeclampsia, it will occur before eclampsia.
Yes.
Okay. And with eclampsia, it is characterized by seizures. Okay, someone fitting. So the moment someone has preeclampsia and then starts to fit, it now changes to eclampsia.
Okay.
And like I said, it's very dangerous because during the fit, one will not be able to breathe properly. So there will be lack of oxygen to the body. This lack of oxygen will affect the brain, and someone can have coma, can have brain damage, or even death, including the baby inside the womb can actually die from this eclampsia. Yes, and I must also make mention that this condition can occur anytime, even in someone who is okay without preeclampsia. So it can occur. Okay. And it can even occur soon after birth. Okay, soon after birth.
Okay. Yeah. You've mentioned to say the causes are not well known to this, you know, to this cause or to this kind of a condition and all that.
Yes.
But what could be the symptoms, maybe, Doc, if you can come in? The symptoms, how do we look at them? How do we try to identify to say this could be preeclampsia?
Okay, so it's a condition that others, it can occur in those people that would have pre-existing hypertension. These are people that have hypertension before they become pregnant. So for others, it will start when they are pregnant. Like he rightly said in the first place, say it will start at 20 weeks of pregnancy. Okay, so most of them in pregnancy, they'll say, okay, swelling is a common thing, but there will be swelling of the legs.
Yes.
Okay, those could be signs that one could be heading towards having this condition. Okay, then sometimes they'll give history of having blurred vision. They couldn't see properly at some point, and others will give history of having had pain on the right upper side. Okay, so they'll give that one, and others will give complaints of persistent headache. Okay, yeah. So these signs could be there, and then you can only pick them as health workers if they come to the health facility. Okay, so that's what is important, is that this condition is silent, like you rightly said, but then it needs to be picked. It can only be picked if they register the pregnancies early and come to the health facilities early, so that then we can pick this sign, these signs and symptoms,
yes.
And then from then we can intervene quickly. Yes. So that we can have a good outcome. Yes.
Okay.
Yes.
Sister, you're actually acting sister in charge from the labor ward. How often do you receive such kind of cases when it comes to preeclampsia?
Almost every day we have patients with severe preeclampsia. So we nurse these patients almost at every day we do nurse these mothers.
Okay.
Yes.
If you look at the ages here, because you're talking of like anyone who is pregnant, mother who is pregnant, but do we have an age where we can say maybe from 15 to 20 they're the most affected, or maybe 35? Do we have any age group that we can talk of to say they're the most affected with preeclampsia?
Yes. So preeclampsia is more common in mothers who are above 35 years of age, and it's also more common in younger ones, those who have having their first pregnancies. So it's more common in younger ones and also adults who are above 35 years of age.
Okay, this is actually a serious condition, as you have explained it, which can actually lead to death.
Yes.
But Doc, do we have a management system that we can look at to say we save these mothers, as we are all aware that we're actually the life givers? Is there a management system that we can look at to say it can actually save our mothers?
Yes. I wanted to actually explain briefly on
Yes,
the causes of preeclampsia so that people can actually understand the treatment for preeclampsia.
Yes.
So the cause of preeclampsia is unknown. We don't know exactly what causes preeclampsia, but we can explain the events and so on. And the most, or rather the common theory that we use is that it is related to problems in the development of the placenta.
Okay.
Okay, so the placenta is basically an organ that provides nutrients and oxygen to the baby. Okay, so that organ can have problems in its early development, around maybe 12 to 16 weeks of pregnancy. And what is wrong there is that the vessels, the blood vessels from the mother to the placenta, from the womb to the placenta, narrows because of some, problems. And so when they narrow, there will be less blood going to the placenta, and hence less oxygen to the placenta. Now, when the placenta does not have enough oxygen, it starts to die as well. So it will die. Any cell needs oxygen. So this placenta, when it dies, it starts to secrete chemicals into the mother's body that now go and damage various organs, vital organs in the body. So now, in terms of treatment, we have seen that when you deliver a mother with preeclampsia, severe preeclampsia, you will find that even the symptomatology and the signs come down and the woman will be okay afterwards. So that is the ultimate treatment. The ultimate treatment is delivery regardless of the age of the pregnancy. If a woman comes at 28 weeks, we have to deliver if that woman has severe preeclampsia, because the problem is the placenta itself. So how do you deliver that placenta? You have to deliver with the baby. Of course, the baby will have challenges outside the womb. Yeah, so that is the treatment. However, I must mention that it's not a complete cure to just deliver a mother, because we have seen cases where a woman was okay throughout pregnancy, during delivery, but can come with preeclampsia after delivery, or even eclampsia itself after delivery. So how do you explain that? It's because you find that the hormones after delivery, that drastic change from the way the woman was during pregnancy to that level, the regulation of the blood pressure is poor. Okay, and also, of course, the delay in shedding of the entire uterus, I mean the entire placenta tissue inside the womb, yes.
Okay. I know Sister has mentioned of, the ages that are really predominant with this kind of cases. Yes, but Doc, if we look at a preeclampsia vis-a-vis teen pregnancies, how do we rate it?
So it's like Dr. Mkape rightly said it, so it's quite common in the teens. Like she rightly said, Sister Sarah said, so we have extreme ages. So we have those above 35 and those below 16. And we know very well for the fact that in our country, we have a lot of teenage pregnancies.
Exactly.
And so most of these teenagers have preeclampsia, okay? Because of course, organs are not mature and everything like that. So it's quite common in the teenagers. And as such, Ministry of Health has a deliberate policy in terms of attending to these teenagers. Because in the first place, they feel intimidated to go to a health facility. So what we've done in health facilities now is for a teenager who comes to register pregnancy, would like to give them that quick service so that we can encourage them to come and seek our services. Okay? And then in the communities, we have what we call the SMAGs. These are Safe Motherhood Action Groups. So these are lay people that are trained in looking at pregnant women. And these are found in the community. They're part of the community. They live with our people in the community. So they encourage these young ones to register so that we're able to pick this condition at a very early stage and encourage them to come to the hospital so that we can take care of them at that early stage, yes, to avoid the complication that come with this condition.
Okay.
Yes, please.
But we're looking at this condition.
Yes.
Does it have an afterwards impact on the teens in terms of the physiology and maybe just the mental well-being of this, teen who is pregnant at that tender age? Do they have any afterwards, effects on them, or it is just okay even if they were to deliver normally and everything else? Does it just become okay for a teen to just have a normal life thereafter?
So, like we said earlier, so what will happen is, like Dr. Mkape said, is that some of them, once they deliver, the condition resolves. But for others, it does not resolve.
Okay.
Hence, would like to check to monitor them after they've delivered, so that we monitor the blood pressures to see that everything is stabilizing. But others, unfortunately, they tend to develop hypertension in later life.
Okay.
So really what is more important is we encourage mothers, even if they have this condition antenatally and they've delivered normally, we still monitor them in the postnatal period. And we still encourage them to come for these postnatal visits, which is at 6 days after delivery, at 6 weeks, and after 6 months, all the same. We still want to see them just to monitor that really there's no danger from this condition.
Okay.
Yes, please.
Sister, you're the one in charge before doctor comes in. How much do you engage these teens? Because I know it is springing out from these teenagers that we are going to have a very useful, generation thereafter. How much do you engage them when they come through for antenatal and even just after delivery, so that they have a healthy life, a healthy baby, and just a health well-being? How much do you involve them?
So when these teenagers come to the hospital to seek antenatal services,
Yes.
we give them first priority. So we don't want them to spend much of the time with adults because they'll feel intimidated. So once we note that they have come for antenatal, we embrace them. Then we have one-to-one counseling with them, and then we see them first so that they can go.
Sorry to cut you. I have asked you this question because we've heard teenagers where they say, "Nikaenda ku hospital, ba nurse bazanishauta." Such kind of things.
Yes.
So that's why I want to get that, so that at least even a teen out there who is listening to you right now will be able to say, I have to go to the facility because I know the nurse there will actually have space for me.
Yes.
So maybe just an emphasis on that one. How much do you engage them?
We want to engage them 100%.
Okay.
Because antenatally we want to embrace them, because pregnancy is a process. So we want to make sure that they feel comfortable during antenatal services, and then when they come to deliver, we are engaging them fully. So we are allowing the next of kin, whom they are comfortable with, to be there during labor.
Okay.
So even after labor, we want to give them health information on how best they can go back to school and continue their education.
Right. Doc, you wanted to add something?
Oh yes, I wanted to add something on the effects of this condition on teenagers.
Yes.
Yes. So one of the effects, there are a number of effects actually, and one of them is that because of the age at which they have the pregnancy, they deliver at that age, they're affected by education, they're not going to school. Okay, and they lose, probably maybe if it's a premature baby, they may lose that baby, and you will find that that can actually cause some mental health problems. So we have seen cases where teenagers with such a condition may end up in a psychiatric hospital. And not only that, but also on the what I would call the obstetric history in terms of future fertility and reproductive life, you will find that most of these teenagers, they are delivered by cesarean section because the birth canal is not yet mature to handle the childbirth. So they end up having cesarean sections, and that has an impact in future pregnancies and how you deliver them.
Okay.
Yeah.
We are talking of Safe Motherhood Week, and this is one of it that we are talking of. We are talking of the commemoration which is coming on, this month.
Yes.
What is there? What are we looking out for?
So the commemoration actually is on Thursday, 22nd May. This is World Pre-Eclampsia Day. So World Pre-Eclampsia Day is just sensitizing communities around issues to do with preeclampsia. But also safe motherhood, we know very well it's a package. Okay, so it has to do with our communities registering, our people in the communities registering early for antenatal, and then also attending antenatal care. Registering on its own is not enough, because others will just go and register and keep the booklet and not attend the antenatal services. Yes. So it's during antenatal services that we are able to track the condition of the mother. And like we are talking about preeclampsia, it's a condition that we can pick up during these antenatal services. But not only that, there are other conditions that could be associated with pregnancy. So there could be issues like anemia, where someone has low blood. We can pick them during these antenatal services, and also able to offer deworming tablets during these antenatal services, and just screen for any other medical condition that could be existing. And also we're able to offer other services like mosquito nets to prevent the mothers from having malaria during pregnancy. We know very well that
Are we still giving mosquito nets?
Yes, we are. Of course, the mosquito nets in a place like Lusaka, you get very few facilities giving it, but I think it's the level of facilities. So at health post, health center, we give the mosquito nets. Okay. Yes, so we're still giving that. Okay. And also give antimalarials. Yes, so these are services that we offer during antenatal. Okay. And then one thing that now we are encouraging is early registration of any pregnancy. What we're encouraging now is as soon as a woman discovers that she's pregnant, she should register. Okay. Of course, I know in our community there are issues to do with no balanji fumo, because one has registered early. Yes. But it's only then that we pick these conditions. So we're encouraging people out there to register these pregnancies as early as possible. Okay. And then another thing that we're encouraging during this Safe Motherhood Week is male involvement.
Exactly.
Yes. Exactly. So male involvement is a very cardinal factor in safe delivery of our mothers, because then there's support from the partner, and they also get to understand the condition. Like now we're talking about preeclampsia. So this is a condition that with the support of the partner, they'll be able to know, to make decisions as well about when, because now when they come to hospital may want to deliver the baby early because of the condition. So if the male is involved, they would make decisions together. And as such, they'll be they feel part and parcel of this decision which has been made. Yes. Yes. So it's very important. Okay. Yes. And then also now what we're encouraging during Safe Motherhood Week is would like the stakeholders to come on board. This is not only a health problem, it's a problem in the community as well. Yes. So would like the leaders in the community to encourage our women to register antenatal early, because it's very important. And of note in the recent past is the abuse of certain substances. Okay, so now the common thing is insumco.
Insumco.
Yes.
Okay, I want the sister to talk about that one. Yes.
You can have that.
But you can still go on.
I can still go on.
Yes.
Okay. So insumco is one of the most talked about thing. Okay. So news or whatever goes on in the community is that insumco help to warm the bodies.
Yes.
Yes. So there are two ways people we've heard use this insumco. One of them is they put it under the tongue just to warm up their bodies. Okay. Yes. But then others also they insert it in their private parts.
Goodness.
Yes.
Is there a way to regulate this?
So it's very difficult. You know, communities are like, it's like the way information is passed on from one person to the next.
One person to the other.
Yes. So this is what is happening in the background. So all we can say maybe is to discourage the use of insumco. Yes. Because one thing about insumco, it has a high content of caffeine. Yes. And you see caffeine will constrict the blood vessels. Yes. And then it will lead to high blood pressure.
Blood pressure.
Yes. So that's why we're discouraging the use of some of these substances. Okay. Yes.
Where are we having this commemoration? Is it just in Lusaka, or it is even in the outskirts?
So for starters, I think we have one in Lusaka, I think on the Dr. Mkape.
Yes.
Yes. Yes.
Okay.
Yeah, so we have, I'm actually part of the project. It's a papagao, it's a Portuguese term that means parrot, but it's an abbreviation for preterm preeclampsia, placental growth factor testing to reduce adverse outcomes in preeclampsia. That's the focus of this research group. It's a global research group involving 6 countries actually. United Kingdom, Brazil, Zambia, Sierra Leone, South Africa, and India. Okay. Yeah, so this research group is trying to see what can be done, even in low and middle income countries, if we can roll out, I would call a biomarker for this condition, where you can test more like on bedside, a bedside test that we can use, just like the way we check for sugar in diabetes. Bedside, we check, does the patient have sugar disease or not? So even with preeclampsia, we are trying to come up with such a test.
Great.
And it works well in the high resource settings. They have, it's now part of the national guidelines in the UK. So we are trying to see whether this can also be rolled out to low and middle income countries. Yes, so in Zambia we have sites at UTH, Women and Newborn, and also in Kabwe, and also Kabwe General Hospital, and then also Kitwe Teaching Hospital, as well as Ndola Teaching Hospital. So these activities will happen simultaneously in these sites.
In these sites.
Yes.
I think we have to come to the close of the program. I know it could have gone on and on, because this is really a very important issue.
Exactly.
Because we're talking of a mother who is giving life to another, person. But I'll start with Sister. What would be your word to the would-be mothers and to those that have, they are already mothers, but they do not have the knowledge or the know-how? Because we've had situations where, a girl comes in, a pregnant girl comes in, advising the other when they do not have sufficient information to give to the other person. A situation where a girl comes in, finds the other person also having, is it edema? And then he says, no, it is actually okay. It's only that maybe you'll be having a baby boy. That's why, your feet are getting swollen, your face is getting swollen. What would be your word to the would-be mothers in closing?
My word to the mothers out there is preeclampsia is a very serious condition, and it's one of the leading cause of maternal death in our country. So how can we manage this preeclampsia? We want our mothers to be knowledgeable about the conditions so that they can be able to look out on the signs and symptoms while they're at home. And we want the mothers to come to the health facilities, because it's during these antenatal visits that's when we are going to discover that they have preeclampsia, and then we'll be able to manage them timely. And then we want also to encourage these mothers to say, seeking antenatal services, who want to make sure that we give them comprehensive antenatal care package, so that at the end of it all, they should have a healthy baby. And
smiling.
Yes, even us, we are happy to see a mother going home with a baby.
Smiling, yes.
And then especially for teenagers, so we want to give them the information they need. Being that they are young, they tend to shy away from the facilities. But we are telling them that they are welcome at the facilities, and then we'll be able to give them the care they deserve.
Great.
Yes.
I'm sure they have heard that word.
Yes.
Dr. Lungu,
Yes, please.
your word to the public as we look at the commemoration of this pre-eclampsia day.
Yes, so my word to the public is, I think, first I'll start with males.
Yes.
Yes.
Male support.
Male support.
Yes, we need them.
Yes, we need them. Very
Yes.
important. Yes. It's very important to escort our spouse as they seek these health services. So please, let's get involved. It's very important. We'll get to understand most of these conditions during antenatal care. And let's support our women. And then in communities, my word to them is, let's encourage all pregnant women to go to the antenatal care. And maybe as our SMAGs, who are the Safe Motherhood Action Group members, come through the communities, let's support them as they do their work. These are people that have received some training. And so when they come to our communities, let's give them the support, because they mean well for our community and for everyone in society. Because at the end of it all, we want healthy mothers and healthy babies.
And health babies. Great. Yes. Doc, as you say your last word to the public,
Yes.
I want an emphasis to the fathers.
Or to the fathers.
To our male folk. Can't it be mandatory to say when a woman is,
Yes.
in that delivery room,
Yes.
a man is also waiting
also
there, because
waiting.
he has to be part of the process. What would be a
Exactly.
word to that?
Okay. Yes, thank you so much. Yeah, so my word to the male partners is
Yes.
that they really need to support our mothers, our mothers,
Yes.
including even if at all facilities allow, because again it has to do with whether the facility
Exactly.
allows or not, for a male partner to actually be part of the delivery units. Yeah, so if it allows, yes, let them be there, let them support the wife. Yes, as she delivers.
Yes.
But I think it's one thing I want to highlight is that as much as this problem is very serious and it has a lot of complications, the good part is that it's a condition that is actually avoidable. Okay, it's avoidable.
Okay.
As long as, like my colleagues have already highlighted, that regular antenatal checkups at an early stage, so that we can detect this problem early and see what we can do with the condition. Yeah, not waiting for symptoms and signs, because the moment the symptoms are there, it's already severe preeclampsia.
Yeah.
Yes, which maybe the BP is above 1/110, which can lead to strokes and so on. Or it can just come with other complications without the BP being raised. Yeah, so I think that is my message. You know, early antenatal care saves lives for both the mother and the baby.
Great. I'm so happy that at least we have looked at so many issues to do with safe motherhood, because this is where life begins from.
Yes.
And if we can take care of this, condition or situation in mothers, I think it will save quite a lot of lives.
Exactly.
And at least mothers will be able to smile at the end of it all.
Yes.
Yes.
Thank you so much for appearing on today's program.
Thank you so
Thank
much.
you so
very
much,
much.
Faith.
All right.
Okay.
Well, viewers, we've come to the end of today's program. We're looking at pre-eclampsia, which is a condition more prevalent in our pregnant mothers. And so let's support these women, because they're the ones who give us life, and they see to it that we actually have a life thereafter. Let's look out for health information, be it online as well as offline. From me, Faith Mutale, and the entire production team, it's goodbye.